Loose skin and stretch marks are just two of the issues facing many women following childbirth. Diet and exercise can't fix the problem, so Dr. Emily McLaughlin has another solution.
So this will be. I was real athletic at the time, teaching aerobics, and I came in and I just had a saggy stomach from having 5 kids. I just wanted my flat stomach back again. She said she could certainly fix that for me.
Dr. Emily McLaughlin is a board-certified plastic surgeon who provides her unique female perspective to patients interested in a procedure called an abdominoplasty.
It's generally a young, fit female, couple of children. They do everything right. They go to the gym, frustrated. When they sit down, their belly hangs over their jeans a little bit. They're doing everything right, but their abdomen is not what they'd want it to be. The cause of the protuberant abdomen in women that have had children is laxity of the abdominal wall. Obviously, your abdomen's very distended in pregnancy, and after pregnancy, the skin retracts to some degree, the abdominal wall retracts to some degree. There are varying degrees of laxity that can persist, which manifests itself as a poochy abdomen, is what a lot of women say.
What is an abdominoplasty?
It's an operation that we tell women, it's a general anesthesia, takes about 2.5 or 3 hours, overnight stay in the hospital. It's an incision almost hip bone to hip bone, very, very low on the abdomen. The purpose of an abdominoplasty is to elevate the skin. You tighten the abdominal wall with a series of permanent sutures, and then the skin that you've lifted up, you drape it back down and you excise the extra that hangs past the original incision. Kind of a technical way to say it, you tighten the abdominal wall and you remove the extra skin.
A tummy tuck addresses the abdomen muscles, but it also helps with stretch marks.
The problem with stretch marks is there's no good solution short of excision of the stretch marks. So stretch marks on the lower part of the abdomen will generally be addressed with an abdominoplasty, but not all stretch marks are always going to be removed. And I think people are okay with that. Almost always stretch marks that are around the belly button are relocated so low onto the abdomen that the upper part of your abdomen looks good, and people are happy with that. There's a lot of urban legend with abdominoplasty or tummy tuck. Every one of my patients after surgery has said, it's nothing like what I thought. People said I had a C-section. I've never had a C-section or a tummy tuck myself, but most of my patients say after the fact, much easier than the C-section. You may feel a little crummy for a couple of days, but you look down and think, okay, it's worth it. It's all worth it.
Every time I look at myself in the mirror, I think, wow, is this me? Every day I just feel more beautiful and sexier than I've ever felt.
I felt like she was the best doctor for me. She understands what a woman needs.
Dr. McLaughlin, she's amazing. The outcome is just beyond belief.